Hello all, this video is about the maxillary nerve. Maxillary nerve is a branch of a very important cranial nerve, the trigeminal nerve. The trigeminal nerve, as we all know, it has three branches. We have the ophthalmic, maxillary and mandibular. Ophthalmic and maxillary, they are purely sensory, whereas mandibular is a mixed nerve. Before I start off explaining the nerve, let me just brief out the structures that I've tried to depict here. To this side is the structures in the brain with the various nuclei that I will explain to the end of the session. This structure here is the trigeminal ganglion that is located in the Meckel's cave at the apex of the petrous temporal bone. This line here depicts the cranial base. We have the anterior, middle and posterior cranial base. As you can see, in the middle cranial base, it has superior orbital fissure, foramen rotundum and foramen ovale, through which the various branches will come out. Towards this side, we have the orbital cavity, the maxillary bone with teeth, the soft palate, auditory tube, the opening with the tubal tonsil. This part here will be the nasopharynx. This important structure here is called as the pterygopalatine fossa. And this is the sphenopalatine foramen that will be present on the medial wall of the fossa. That will be the communication to the nasal cavity. On the posterior wall, we have the foramen rotundum, the palatovaginal canal. Here it will connect through the pharynx. At the lower border, you can see the pyramidal process of the palatine bone with the various canals. Now to start off, the maxillary nerve. So before starting the maxillary nerve, this important structure has to be discussed. This is the trigeminal ganglion. This is mentioned to be the sensory ganglion of the trigeminal nerve. So this is located at the apex of the petrous temporal bone. The cell bodies are located here and it has central process that goes up to the brain, and the peripheral process will come out as the various nerves. So the first branch, as you can see, it has passed through the lateral wall of the cavernous sinus. It goes to the superior orbital fissure, enter the orbit, and there it will branch out. Our topic of interest, the maxillary nerve, it will come here to the lateral wall of the cavernous sinus below the ophthalmic nerve. Then it will exit out through the foramen rotundum and branch out. Before branching, it has given a meningeal branch. So what are the various branches of the maxillary nerve? In the middle cranial fossa, it has a meningeal branch. In the pterygopalatine fossa, it has ganglionic branches, the zygomatic branch and the posterosuperior alveolar. There are various ganglionic branches that I will explain in detail. Then in the infraorbital canal, the middle superior and the anterior superior alveolar nerve. And then there are three terminal branches, the palpebral, nasal and labial. So let's start off from here. So as you can see, it has exited out. Before exiting, it gave a meningeal branch that will supply the dura mater of the cranial base. Now that it has exited out within the pterygopalatine fossa, it has three branches. What are they? We have the ganglionic branches, the zygomatic branch and the posterosuperior alveolar. The posterosuperior alveolar will enter through the posterior border of the maxilla to supply the molars. The zygomatic will enter through the infraorbital fissure to enter through the lateral wall of the orbit. Then it will pierce the zygoma and branch out to the zygomatico-temporal and zygomatico-facial, supplying the skin of the face and anterior temple. Then the various ganglionic branches. So first is the orbital. As you can see here, the orbital branch, it will enter into the orbital cavity through the inferior orbital fissure and it will supply the periosteum of the orbital wall. Then there is the lacrimal. The postganglionic fibers will communicate to the lacrimal branch of ophthalmic through the zygomatico-temporal nerve. Then the nasal. It will the nasal branch will enter into the nasal cavity through the sphenopalatine foramen. It will come here and branch out into three branches: the lateral postero-superior nasal, medial postero-superior nasal, and nasopalatine. Lateral postero-superior nasal will supply the posterior parts of superior and middle concha. The middle will supply the roof and nasal septum, the posterior part, and the larger branch, the nasopalatine, will enter through the incisive fossa to supply the anterior part of hard palate. Then we have the palatine branches that will enter through the pyramidal process of the palatine bone. And here you have the greater palatine nerve that supply the posterior hard palate, the lesser palatine nerve supplying the soft palate. Then we also have the pharyngeal branch that enter through the palatovaginal canal to supply the nasopharynx behind the auditory tube and tubal tonsil. So these are the branches in the pterygopalatine fossa. The intraorbital nerve is considered as the continuation of the maxillary nerve in the intraorbital canal. There are two branches, one at the posterior border and one at the anterior border of the maxillary sinus. The middle superior alveolar supplying the premolars and the anterior superior alveolar supplying the anterior teeth. This will also supplies the maxillary sinus and the anteroinferior part of the nasal cavity. And finally, we have the terminal branches, the palpebral, the nasal, and the labial, that supplies a large area of the skin of the face and associated mucous membrane of the upper lip and cheek area. Now that we have explained all the peripheral process, let's go back to the central process. So here you can see that the central process will enter at the upper border of the pons. So we have the various nuclei of the trigeminal nerve here. See, this is the midbrain, the pons, medulla, and the spinal cord. In the midbrain there is the mesencephalic nucleus. Then there is the superior sensory in the upper part of the pons. Then the spinal nucleus will extend from pons all the way to the first two segments of the spinal cord. Once the sensory root has entered the upper part of the pons, it will divide into two segments. You have an ascending to the mesencephalic and descending to the superior sensory and the spinal nucleus. The motor nucleus is associated exclusively for the mandibular nerve, so I am not discussing it here. The mesencephalic is concerned with proprioception at TMJ, muscles of mastication, superior sensory with touch and pressure, and spinal nucleus with pain and temperature for most of the face. So once it has reached here, from here it will go to higher centers. So before explaining the higher centers, let me just try to revise how the brain basically looks like. So we have the forebrain with the cerebrum and thalamus. Then below that is the midbrain. Then at the level of the hindbrain there is the pons, medulla, spinal cord, and here you have the cerebellum. So where are our nucleuses located? We have one here. Midbrain we have the mesencephalic. Then the upper part of the pons we have the superior sensory, and then we have the spinal all the way from here. So from there it has to go to the higher centers. So let's start off. So these are our nuclei. So at the pons we have the superior sensory and the spinal. So most fibers from the superior sensory and spinal, they will cross the midline to form the trigeminal lemniscus, and they will synapse here, that is a ventral posteromedial nucleus of the thalamus. So from here it has reached here. Now it has to go above. So it has crossed from the trigeminal lemniscus at the ventro-posteromedial nucleus of the thalamus. It terminates there, and from there the thalamocortical fibers will arise, and that will terminate at the sensory cortex in the cerebrum. So from here it has crossed and reached here. That is the trigeminal lemniscus from here. This is about most of the fibers, but there are some fibers that will terminate on the same side of the thalamus as well. Then we have the mesencephalic nucleus. The mesencephalic nucleus will it will pass through the trigeminocerebellar tract, and it will synapse at the cerebellum through the superior cerebellar peduncle. So that's about the higher centers. Now, what the various nucleus of the trigeminal nerve will be referred to as, you'll be hearing terms like GSA, branchial efferents. Most of you will be taken aback thinking what it is. It's very simple. General somatic efferents. Just split the term. As I told you that the GSA means all the sensory root is all the sensory nuclei are referred to as the GSA. So afferent means from the body to the brain. So that is sensory afferent. Somatic means general body part apart from the branchial arch, what comes from somites. So somatic. And general sensation. Well, the maxillary nerve will supply only general sensation, right? Pain, temperature, etc. We don't consider any special sensation like taste, smell. That's not there. So it is GSA. The all the sensory root will form the general somatic afferent nuclei. Then the motor nuclei will form the branchial efferents. Motor nuclei will form the branchial efferents because it will form part of what is called as the mandibular nerve. Now, what is mandibular nerve supply? They supply branches of the derived from the first branchial arch. So that is why it's called as branchial efferent. Efferent means from the brain to the muscles. So efferent is motor. So branchial efferent means motor supply. So that is about the maxillary nerve, the various branches. The peripheral process I tried to explain. Then we have the central process and also the higher centers. Thank you.